Hi guys, welcome to my channel. I am Dr. NGM, Dr. Njoku Martins, NGM for short, and I'm a medical doctor living in Nigeria. I make YouTube videos to help individuals navigate the challenges of medical school and share the experiences of other doctors through interviews and interactions. Yeah, and I'm currently doing my housemanship. I'm currently doing my internship in Nigeria. This is my week 22 of 52 weeks of housemanship. So 22 over 52. We're almost there. We're almost there. Well, we are legit halfway there right now. Do you get? And this is my second to last week in pediatrics. So, guys, what has been up aside ward rounds, calls, outpatient clinic, specialty clinic? Oh God, long calls, weekend calls. Damn it, every single thing has been chaos. In all honesty, everything has been chaos. So apparently Tuesday was public holiday, yeah, but I was on call. It was supposed to be a weekday call, but it turned out to be a weekend call because it was declared public holiday. My consultant specifically told me that Buhari was still showing me Shege from the grave. It was so funny. But then, well, we survived Tuesday and I was on call yesterday, so it looks like my eyes are a bit bulgy. You get, I haven't slept well, literally, but yeah, I'm pretty pleased to have finished with weekend calls. I shall not be doing any other weekend calls, in all honesty. Amen. But next week, I'm on call again. Oh, God. It's fine. We shall survive. We shall freaking survive. So, I wanted us to talk about something that I know a lot of Nigerian doctors are conversant with, and that is SAMA, or like it's called in most centers, DAMA, that's discharged against medical advice or signed against medical advice, whichever one. But I kind of prefer sometimes to call it SAMA because, like, you signed against medical advice, not that we discharged you. Do you get? Whatever is called in your center, I guess you know what I'm talking about. That is patients that decide to leave the hospital against medical advice, patients that say I don't want your care anymore, and then they just sign and pick up their things and leave the hospital. Yes, those patients. A lot of them. Now I know this is like ethical area. Do you get? A lot of those patients sometimes after they finish signing against medical advice, you still see them in the hospital. Like they are still in the hospital, still around, like still on their bed. Do you get? They maybe they are trying to clear out their bills or they before leaving the hospital, or they are still looking for money to clear out their bills, do you get? Or they are just taking maybe 1 or 2 days before leaving the hospital. Now, that is something we doctors should actually take with great importance. Do you get? When coming there, something happened in the past couple of days here. A patient signed against, like, we didn't know. We're on call. As per team on call, you have to see all the patients in the ward. You get, you have to do ward rounds, you have to see them, you have to give them medications and all of that. And one of the patients, it has happened to me on several occasions actually. One of the patients said, well, doc, my child does not have IV access, and her medicine is still remaining. Like she's still on prescription. There's still some drugs we need to give to her, and all of that. I was like, okay, fine. Let me get your medications. And I went to the nurse's station, went to get the chart of the patient, only to find out that they had been discharged. For in order for me to give her the medications, I needed to set another IV access. So in my bid to try to, oh, let me see the patient's chart, let me see the patient's folder and know what is being done for this patient and all of that, I discovered that they had signed against. It is important for us to note that if a patient signs against medical advice, the patient is literally saying, I do not need your care anymore. I do not need you to continue whatever line of care you have for my child. Do you get? I do not need you to touch me. Do you get? In some other places, If you go ahead and maybe give that patient any medication, maybe something happens to the patient in the long run, or maybe the patient maybe develops one other symptom or whatever, you are liable to be sued. You have to be very careful on this actually. Any patients that SAMAD or that DAMAD or that signed against medical advice and maybe for some reason is still in the hospital, those particular patients, be very wary of them. They have signed against medical advice. The least or the only thing per se that they don't do in most of these centers is that, and this is for most patients that were oxygen dependent, like for the in the course of their stay in the hospital. Now, for these patients that are oxygen dependent and are still in the hospital, do you get? We just still leave them on the oxygen. Do you get? Because you know that it's that oxygen that is literally keeping them alive. Do you understand? So whether the parents have signed against or whatever, you don't take out the oxygen until they are ready to go, until they say, take it out, I'm taking my child away from the hospital. Do you get me? So whether they have signed against or nothing. And I had another experience too, just in my most recent call. Yeah, we were giving medications after doing rounds and all of that. We were giving medications, and a particular patient had SAMAD, had already signed against, like, okay, I'm taking my child out of this facility. Do you get? And the child started started having respiratory distress, started coding blue literally in English terms. And yeah, you needed to resuscitate. So you don't say, except I don't know the practice in your own center, but you don't say because I signed against medical advice, nothing should be done for my patient and all of that. Well, that's a different talk for another day because there's something about do not resuscitate and all of that. That's a totally different thing you get. But in this case, you just legit signed against medical advice. You want to leave the hospital. You signed a discharge form against medical advice. You get? So in that context, we had to resuscitate. We had to attempt at resuscitating the patient because the parents did not refuse it. Do you get? The parents did not say, no, leave my child because, well, they wanted us to attempt the resuscitation process. I feel like they had already zeroed their mind because the child had a very malignant form of cancer. I think it was rapidly progressing and all of that. Do you get? That's a sad story for another day. Do you get? But then, yes, in that case, you have to resuscitate. You have to attempt at resuscitation. Funny thing is that we see a lot of these patients in the hospital, and the annoying thing is that most of them, after they have signed against medical advice, you see them later in chair in the children emergency room. That's for pediatric patients. Some others, you see the adults in accident and emergency room, and you're asking yourself, so the care we were giving to you would have literally prevented you from all of this. You get? Why did you refuse it? So, guys, in general, my 22nd week in housemanship um was actually total chaos. You guys, I don't think I've even recovered from my night shifts of yesterday. After I got back home, I legit just had to look for food, and unfortunately, there was nothing in my fridge I could possibly eat that was food. But thankfully, I had fruits, and it was very late, and yeah, I just had to eat and sleep a little, but I'm still very much sleep deprived. Do you get? But then, yeah, my 22nd week was fine. You get? It's just like when you ask a child, "How are you?" and then the only reasonable response the child can possibly give you is, "I am fine," when he's literally not. Do you get? But then I will be fine. So if you're yet to subscribe to my channel, please do well to do so. This journey has been quite a lot for me. Do you get? But then sometimes when I'm documenting about my journey so far in housemanship, I'm like, well, it's not as long as I think it would be. Do you get? But when you're experiencing the days, it's actually a lot. You get when you're experiencing the days, but then the week go by really fast. You get, and then you're in the next unit and you're doing the next thing and you're doing the next thing, and I just cannot wait to be done. This is legit almost like the half of my housemanship, almost like 6 months since I came to this place, since I started this journey. And I would say I'm really very grateful for it. And I do pray my last week in pediatrics be cool. I really do pray my last week in pediatrics be very cool. Like, and I need to start signing my forms. After each unit, you tend to sign some forms to clear you from the department and then usher you into a new department. And I can't freaking wait to get that aspect rolling. And I do hope I get really good scores. Well, even if it doesn't really matter, but well, to just make me smile for the moment. But yeah, I think that's that. I know that the coming weeks have really beautiful things for us. I am definitely sure about that. We have really beautiful things coming up on this channel, and I can't wait to show you guys and to share you guys and to share it with you guys. Sorry. So I'll catch you guys in the next one. Peace.